The Democratic Republic of Congo has received more than 16,000 doses of an Ebola vaccine as authorities step up efforts against the ongoing outbreak. More than 2,500 people have already died, and health officials from the WHO are warning this epidemic could surpass the deadliest on record that occurred between 2014 and 2016 and caused over 11,000 deaths across West Africa. Let's take a listen now to the country's health minister.
The Democratic Republic of the Congo is facing a very serious Ebola outbreak, an outbreak that has already claimed the lives of hundreds and hundreds of our fellow citizens. Already, more than 2,300 people have died, and the outbreak has affected more than 5,000 people. And we have realized that public health measures must be accompanied by other measures, particularly medical interventions.
Now we can bring in Dr. Muhammad Munir, professor of virology at Lancaster University in the UK. Thank you so much for joining us on the program today. So first off, let's talk a bit about these vaccines that are arriving into the country. They're for a different strain of Ebola than the current outbreak. Will they help?
Well, thanks for having me. The vaccine for this particular strain of Ebola virus called Bundibugyo is not currently licensed, is not available. However, as a substitute and a surrogate, a vaccine that was previously approved for a strain of the Ebola virus that has caused earlier outbreak called Zaire Ebola virus has been approved, and this is the vaccine that is currently being kind of shipped to the Africa to provide as a solution, as a surrogate. And this particular vaccine has already been tested and validated in the laboratory and the animal settings. However, the evidence is that this vaccine would give a strong protection against the Bundibugyo strain are lacking, are very poor. However, this effort will certainly buy out some time while other tailor-made vaccines, one in the UK and one in the United States, are being developed.
Now, Professor, what's the current treatment for people who are already infected?
There is no approved vaccine, neither is there any treatment for this strain of Ebola virus. However, what is being done is that people who are identified positive, they are given supportive therapy and making sure that the fluid level, the overall frail condition of the person is under control to kind of let the body itself recover from the infection. And therefore, the critical bit is to have to avoid the infection at the very first stage by stopping the transmission, by controlling the infection, as there are not very many options once person get the infection.
Now, health officials have been warning that this outbreak is spreading faster than their response. So at this point, what more can be done to get it under control? And is part of this a public health failure?
Absolutely. I think this is the most critical part, that controlling this infection must be done at every cost possible. First, again, as we were talking before, there is no treatment, there is no vaccine approved for this strain. And one of the particular aspects that is relatively less focused on is that there are clusters of infections that are not connected to other infections. Those are known. So which means that there are more people in the community that are positive for the Ebola virus than are initially anticipated. And one of the major reasons for this one is that the virus was identified way later than was originally spreading, which means that the virus is a lot more penetrated in the community. So until we don't really know how much are the cases and what are the transmissions that are happening, controlling or containing this infection is going to go nightmare.
Now, as well as the outbreak continuing to spread, compounding that issue, there have been attacks on public health workers and medical facilities. Some have actually been burned to the ground. So we're seeing some mistrust from the public. How can that be overcome?
I think this is also a very critical aspect because mistrust will always come when there is a lack of information or disinformation out there into the community. And this is a very critical aspect because first, the overall healthcare infrastructure is very frail and the availability of the healthcare worker is very limited. So you can imagine from the start of this outbreak from the mid-May, there has been over 160 attacks onto the people who've been at the forefront of protecting this infection. And I think that the major part that we can play is to pass on the right information to every person in the community, especially through the established local healthcare workers and the NGOs, to provide them the information that everything that needed to be done could be done as long as there is a support from the local community to understand and properly conceive the message.
Now, Professor, we also heard earlier this week from the UN warning that international funding for this response is running low. So what more can be done to assist from the international community?
When it comes to controlling infections like Ebola, which are relatively rare, but once they are there, they are really deadly. Proper supply of the resources are really critical, not only for the healthcare worker when it comes to PPEs, but also the supportive therapy, the infrastructure that is required to not only take the sample, but also to test them for the presence or absence of the infection. So I personally believe the resources that currently are being deployed are really low compared to the scale of the outbreak. And as the World Health Organization already stated that if the resources are adequate, they can contain the infection within 3 months. And longer the outbreak goes, the risk is not only spreading within the Africa, but also it could lead to some sort of outbreak outside of the Africa, which we have seen sporadic cases.
And now, Professor, we've heard that the African CDC is warning that only about 30 to 40% of cases have been detected. So what does that tell us about the current size of the outbreak and any idea when they can get this under control?
Absolutely critical, because until we don't really know what is the scale and the level of the positive cases in the community, we are shooting in the dark. And that is further compounded by the fact that first 3 or 4 months of this outbreak has been completely ignored just because of lack of proper testing availability. So therefore, every efforts that can be done to go into the community to test every possible cases that can be detected later, earlier the better. So there is a particular challenge over there. The challenge is that the overall infrastructure for testing, laboratory-based testing system is not available in every province, and that is one of the challenge. And the second issue is that the samples those are taken from the infected or possibly infected person can only be handled within a medium-sized laboratory. So this is not the test that can be done on site, and therefore the overall time required to take the sample from the person and to get the result back is around 24 to 48 hours, and that is really the major challenge. And more infrastructure is built, more support is provided, quicker test result definitely means that a shorter time for the transmission that is ongoing in the community.
And Professor, one final question. Obviously, we know Ebola outbreaks aren't unknown in the region. So did you expect the response to be better this time, and are there lessons to be learned?
I think there are a lot of lessons to be learned, not only from the previous Ebola outbreak, but also from pandemics like COVID-19. But unfortunately, those all messages are unlearned so quickly, which is unbelievable. And I personally believe that this particular outbreak is outpacing all the efforts that are currently being put in place. And this is a silent killer for the community. You can imagine that, around 50% of the infections that has resulted and confirmed cases have unfortunately died. That means that is 20% of those that are tested positive and are confirmed positive have died in last 30 days, which is really a shorter time compared to previous outbreaks. So a lot more need to be done.
Doctor, thank you so much for joining us and sharing your expertise with us on the program today. That's Dr. Muhammad Munir, professor of virology at Lancaster University in the UK.